Hi, and welcome to the Langley Connection. This is the show where health meets community, brought to you by Langley Health Services. We'll be sharing helpful tips, expert insights, and stories that matter to you and your family. Thank you for listening. We're excited to connect with you. Welcome everyone to the Langley Connection. My name is Brody and I'm your host, and joining us today we have our very own Langley Health Services provider, Shaun Garner. So thanks for joining us.
No problem.
So you're in our Homosassa office. How long have you been at Langley?
Almost 3 years.
3 years. Wow. Time's flown by. So we want to learn a little bit about your background. So I know a little bit, you did a little bit in respiratory before you were at Langley, correct, at the hospital?
Yes.
So tell us a little bit how when you became a provider and then coming to Langley. Tell us a little bit about
that. I was basically worked at Citrus Memorial almost 10 years total.
Okay.
So I started out in the emergency room as a nurse. Then I went to the cath lab for a couple of years. Then I got my nurse practitioner license when COVID was very bad. Ended up being, recruited into the pulmonary critical care, and I stayed there for, I want to say maybe 4 years, and then left acute care and came to Langley.
Okay. I'm sure you got to see a lot working in, one, the emergency room, but two, working during COVID times. I'm sure that was a stressful time. So thank you for everything you've done there as well. And then, you are currently a nurse practitioner at our Homosassa office. You've been here 3 years. You're a family practice, so you establish patients. So if you're needing a provider in Homosassa, please go to Shaun. He's a great provider. I worked with him for a few years, and he does take very good care of his patients too. So this month we're going to talk about Alzheimer's. It's Alzheimer's Awareness Month, and we want to kind of bring attention to it. And let's learn a little bit about it. So before the episode started, we talked about dementia and Alzheimer's. There is a difference. Can you tell us a little bit about that difference and what it is?
Yes, dementia is kind of an umbrella of disease that falls under memory loss.
Okay.
You could have, for instance, a vascular dementia, which means that there's not blood flow getting to a certain part of the brain. And at that point, it atrophies or it shrinks, causing the memory loss. Whereas Alzheimer's is an actual diagnosis based on a process where proteins build up in the brain on the neurons that signal the information back and forth and communicate. And when that happens, they die. So the synapse is the gap between where they jump across and send information. So once those neurons are dead, there is no repairing those neurons. So it's a progressive, debilitating disease, basically.
Okay. And we talked a little bit about the episode of how we all just kind of forget little things like that. So, obviously as we age, it kind of gets worse. We kind of don't remember things or forget things. What's the difference between that normal aging and then Alzheimer's?
So normal aging, obviously as we age, there is some type of atrophy that happens in the cerebrum of the brain, and that just happens when you get older. Those memory lapses are something as simple as, what did I come in the room for? And you forget, but then you remember a few minutes later, I came in there to get my shoes or something like that. Whereas dementia or Alzheimer's, that memory process doesn't come back. Okay. Like some early warning signs, for instance, would be people just forget the date, time, place. They might take their car keys and put them in the fridge instead of on the counter. They might take their milk and put it on the counter instead of in their fridge, those kind of things. And then eventually long-term memory starts to be affected, and it affects their daily life. They forget how to go to the bathroom, how to feed themselves, that kind of thing. So it's progressive in nature. Okay.
So as, an individual or a family member starts noticing that signs, when should they do it? When they first see it, or is it something they should kind of wait a month to kind of see it? When should they start looking at getting care or a diagnosis?
I've always told my patients, family members, if you start to suspect something is not the norm of your family member, and it's not something as far as what I come into the room for, like I said, and then they figure out, that's what it was. But you see that it's starting to affect their daily life, their hygiene, their ability to be productive, their ability to manage their own finances, things like that, that's when you need to reach out, because the earlier that we detect this, the easier it is to treat symptomatically.
Okay. And then is there certain risk factors that could, increase the likelihood of being diagnosed with Alzheimer's? Is there something,
Yes.
Whether we're eating or what kind of factors is it that would?
So a couple of factors: greater than the age of 65.
Okay.
A first relative, such as a parent or a sibling that has a diagnosis of dementia or Alzheimer's. High blood pressure, diabetes, hypertension, which is high blood pressure. Those are all risk factors. Things we can do to try to prevent it is exercise, eat healthy, such as heart healthy diet or the Mediterranean diet, which you'll hear about that a lot with every disease, but physical activity, maintaining social interactions, physical interactions like doing puzzles, doing crosswords, keeping your mind and your brain, functioning, and repetitive things.
Correct. So you kind of talk about that, we really need to make sure that we're eating healthier, staying more active, and outside of Alzheimer's, that's just a good thing, physically being healthier and doing that. It's a good all around. When we talk about mental health as well and this, but we got to make sure that we do that continuously. It's not we just do it for a month and we stop for it. It's not going to continue working that way. So, what should someone do when they are diagnosed with it? Where should they go from there?
So, keeping up with your primary care physician appointments. Typically, you would want to get a neurologist on board just to follow, have another set of eyes on the patient, start treatment as soon as possible. There is no cure for this, but we are able to slow down the progression of the disease with symptomatic treatment, and there are medications out there that help with that. But like I said, it's a progressive, debilitating disease that eventually, the patient does, pass away.
So when we talk about, when they're kind of going a little bit back, when they start seeing those signs, one thing, go to your primary, go ahead and kind of tell them this. And that way the primary can, kind of start managing it and trying to treat it as well. But also, let's go ahead and get you a referral out. That way we can get you to a specialist and
Absolutely.
do that. So is it something, okay, I've got to follow up in 6 months. Let me wait till 6 months to bring that to my primary? Or is that something that they should go ahead and, hey, I need an emergency appointment next week, or what should they do? They
should, as soon as you see the symptoms, get in as soon as possible. Sometimes it's difficult to get in, but for instance, for me, make an acute appointment, even if it's 15 minutes, so I can see what's going on. And we have some tools that we can do, such as cognitive testing, memory testing. We have those tests available to us, which kind of streamlines the treatment process.
So I know we do have in our Citrus County especially, but and also at our Ocala office in Sumterville, we have a walk-in clinic, and that might not always be with your primary doctor. Should they still maybe go to that walk-in clinic and kind of get that, or should they really try to get that appointment with their primary doctor?
I mean, if it's going to take a while, such as 3 months to get in, I would say yes, go to a walk-in clinic. But I think for continuity of care, it would be best that the primary knows that patient very well.
Exactly.
And they can also do an assessment and say, yeah, this is not the normal patient that I see. And it can be confusing, too, because the older the population that we have, it could be something as simple as a urinary tract infection that is causing the behavioral changes, the memory problems. So that needs to be ruled out before we just jump on some type of progressive illness.
Correct. And then obviously probably the sooner you get treatment, the better, and helps to keep longevity of life as well, and kind of keep our loved ones the same ones that we always know them. So as a family member, what is some things that they can look at doing, to try to help one manage this and be there supportive for the individual that's diagnosed?
That's a hard part with the family, because it normally starts out as acceptance. They have a hard time accepting that this is now going to be the reality of their loved one. And it's a financial strain on them. You know, when the disease gets further along, they can't be left alone, you know, and then the family can't work, you know, they have to stay home. So I encourage them to use respite services through like HBH Hospice, VITAS, any of those, where they will take the loved one in for a week at a time to give that person a break. And I think that's very important for family members.
No, absolutely.
Not to get wrapped up into the whole process and have some time for themselves as well.
No, absolutely. That's huge, you know, mental, kind of like you said, a break, you know, and it's not that you're taking a break from your loved one, but you can't take care of your loved one if you can't take care of yourself.
Absolutely.
And so I kind of refer that a lot to our team and making sure that we always take care of ourselves so we can take care of our patients, so we can take care of our loved ones and going from there. So what are some of the biggest challenges caregivers face with that, like your loved ones? How can they really make sure that they are take caring themselves? I guess would be referring to VITAS or going from there. What else is this?
Yeah,
is there anything
you know,
else that they could possibly do?
You know, reaching out for any support groups. There's a lot of support groups out there for loved ones, not just dementia, but hospice care, all kinds of different things. You have to have a support system as the family, or you eventually it will overtake you because you don't have the resources that you need. So reaching out is not a bad thing. No. It's a good thing to help you through the process. And I really appreciate what, for instance, the hospice centers do with the respite care, because being early in my career as a CNA, I worked in a dementia unit, so I saw the impact that it had on the family. And without that support system, you're gonna crumble. It's just a normal, natural human process.
No, completely understand that. You know, I know it's kind of a scary time, like you said. You know, one, acceptance of it, but understanding that this, you know, it's impacting both lives, the loved one as well as the family members. So it's really important that we kind of do whatever we can to possibly help them, making sure, like you said, keeping those appointments with your primary, keeping your appointments with your specialist to keep treatment going, and then kind of understanding the next steps. But the support groups is huge. Understanding what other people are going through, how can that possibly help you as well, and then going from there. So, you know, one of the biggest things, you know, family members accepting, but sometimes also the person that could possibly be diagnosed accepting it. How can a family member possibly bring that up of going to the doctor to say, hey, this is something that might, you know, happen, or this is what I'm noticing? How can they manage that and go from there?
So I suggest basically first, before you present it to your primary care physician and say, hey, I think my mom has dementia, that's scary enough. So you really need to have a sit down conversation with your loved one and an environment that they know, not somewhere else that they've never been, like in the home, in a comfortable environment, and have a heart-to-heart talk and tell them, these are the differences that I'm seeing, and I'm concerned that it's now affecting your daily life, your happiness. You know, have that conversation, so when you do present it to the primary care or the neurologist, they already know that something's happening. Things are changing in my life, so it's not a shock to them.
So, sorry, circling back as well, is there any behavior changes they might notice with this?
Yes. So as the disease progresses along, there are some behavioral changes, such as they can get violent, they can hit, scream, use foul language. Those are all part of the process. So once again, having that support system on knowing how to deal with that, because maybe that loved one was never violent or said any kind of foul language ever in their life, and now all of a sudden it's happening. It's a big shock. I even had a patient who was a priest, and later in his disease process, that's what he started to do. And you know, in his daily life, he would have never have done that.
Yeah.
But so it's important to educate yourself, number one, about the symptoms, the the path that they're going to take. Possibly not all get violent, not all use foul language, but it could happen. So preparing yourself is one of the ways I feel you can better manage it.
Yeah. So, one of the things that we can do as well is we partner with a lot of organizations and communicate with a lot of organizations that have that support. So always come to us if we're your primary to go ahead and establish that appointment. And then we have resource coordinators that can help set up those, whether it's groups or referring you out and making sure that we get the best care it is. Because life is not over with a diagnosis. And I think a lot of people get scared about that. And I think it's something, hey, life is still going to happen. We're still going to make it work, but it's the best to get it diagnosed early. So, I'm glad we could bring this up because it is Alzheimer's Awareness Month. So we want to really make sure that we're bringing awareness and attention to this. And if it's something that your loved one is encountering, or if it's something that you yourself might be encountering, just make sure you're getting those. We do a little test in the office that can kind of make sure that, is it something happening? So we can look at possibly saying, yep, we do need to refer them out and go from there. But so is there anything you would like to leave the audience with about Alzheimer's awareness?
Just back to how I said, make sure that you are bringing up your concerns early when you start to see cognitive or behavioral changes happening. Like I said, it could be a metabolic issue. It could be a urinary tract infection. We don't know until we dig a little deeper and we do those tests. And then we can go from there. The earlier we start treatment, the longer your loved one is going to not have to go through those changes as fast as they normally would.
No, absolutely. I think that really sums it up. But thank you for being on the show with us. We're glad to have you and bringing awareness to the attention. If you need a primary care provider, Shaun is the person to go to. He's there in Homosassa. But until then, we'll see you next time, next episode. Thanks for listening to the Langley Connection. If you enjoyed today's episode, please like, comment, and share. Be sure to follow Langley Health Services on Facebook, Instagram, X, and YouTube to stay connected and never miss an episode. Until next time, stay connected, stay informed, and stay healthy. This has been the Langley Connection, connecting our community to better health, one conversation at a time.